everyone. Welcome back to my channel. Welcome to his Pharmacology Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you rarely find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. So today we are here with the end of the year season. Yes, I've introduced a new season very recently. The end of the year, the end of 2025 year season. In this we're going to cover some special topics which will be relevant only to this particular year. Now, as we are celebrating the World Antimicrobial Resistance Week, and it is ending today, so a very relevant topic in this particular context I have for all of you. I'm going to cover an overview of the year in regard to antibiotics and antimicrobial resistance. So today we are looking at one of the biggest global health challenges, antibiotics and antimicrobial resistance, and how this year this battle was shaped up. Let's have an overview of this particular thing. There were so many novel antibiotic launches to combat the emerging resistance, and there have been breakthrough trends in the rapid diagnostics. So first point is rising resistance trends highlights globally. Now this year actually what happened was that the international surveillance system like GLASS, capital G, capital L, capital A, capital double S, and the national antimicrobial resistance networks, they reported alarming updates. There was increasing carbapenem resistance in Enterobacteriaceae. There was rising colistin resistance even in the isolates in the community, and there were more MRSA and VRE, capital VRE, clusters in the tertiary care centers. So the trend is unmistakable. Resistance continues to outpace the discovery, and that's the truth. Secondly, many novel antibiotics, they receive approval. The pipeline is very thin, but there were few promising drugs which entered the scene this year. New beta-lactam or beta-lactamase inhibitor combinations, novel tetracycline derivatives, a very novel next generation aminoglycoside with better efficacy for multi-drug resistant organisms. These all entered the scene this year. Now these drugs are very essential additions to the limited arsenal. Third point, revival of the old antibiotics for multi-drug resistant infections. The renewed interest and the list of the older drugs is including fosfomycin, minocycline, chloramphenicol. These all resurfaced due to their activity against the resistant strains. But always remember, they must be cautiously used under the stewardship guidelines. Fourth point, there was a major breakthrough in the rapid diagnostics. This year gifted us with very fast, smart ways to detect the infection. AI, artificial intelligence, integrated pathogen ID systems, point of care, molecular diagnostics, PCR panels, which provide results in only about an hour. All these different technologies and novel treatments trends, they all mean quicker, correct antibiotic selection and reduced unnecessary broad spectrum use. That is in the favor of the rational treatment therapy. Fifth point, hospitals, they strengthened antimicrobial stewardship programs. All the hospitals and all the healthcare institutes, they upgraded their antimicrobial stewardship strategies. And how did they do that? Real-time dashboards, post-prescription review audits, electronic alerts for high-risk antibiotics, automatic stock orders, all these different kind of and novel interventions, they all showed measurable reductions in the inappropriate use of antibiotics. Next point, important updates in the clinical guidelines. There are several specialties and they all revised their treatment guidelines based on the new evidence. What are the key updates in this particular regard? Narrower therapy recommendations, shorter antibiotic courses, new first-line options for pathologies like urinary tract infections, respiratory tract infections, that is UTIs, RTIs, and also SSTI. Shorter courses. They specially gained strong clinical support. All the doctors and physicians, they supported these shorter courses. 7th point, community antimicrobial resistance awareness grew rapidly. There were so many public campaigns and they all spread the awareness about not demanding antibiotics for viral pathologies or ailments, completing the prescribed courses right in time, avoiding the leftover antibiotic use. We don't have to do it beyond the prescribed time also. That is also important. This cultural shift, this community shift is very, very crucial. It's very, very critical in fighting the antimicrobial resistance. Environmental antimicrobial resistance. It came into focus. There were highlights upon the antibiotic waste and also the effluent. They are the growing antimicrobial resistance drivers. So the main focus and the emphasis was laid for improved wastewater treatment, regulation of the pharmaceutical discharge, monitoring of the agricultural antibiotic use, and you all know the theme One Health. Yes, the One Health approach. It gained a very strong worldwide traction. It was so captivating. Next point, advances in the phage therapy and many alternative solutions. Phage therapy trials, they gained a lot of momentum this year and there were many highlighted encouraging results against the multi-drug resistant infections. And also there were additionally many other innovations like antivirulence drugs, immune modulating therapies, microbiome based interventions, and these all can become game changers in the upcoming decade. Yes, they can. And last but not the least, the global antimicrobial resistance policy. The push got intensified with the help of the government, plans, strategies, actions. There was a lot of focuses and work done upon the action plans, funding of the whole antibiotic research, strengthening of the surveillance systems, and also encouraging the responsible prescribing. All in all, there was a lot of wonderful international cooperation, but much more is need to be done in this particular direction. And my dear friends, that was the year in the antibiotics and the antimicrobial resistance. It was a year full of challenges, hard lessons, and very important progress. If you found this video useful and you found it relevant, don't forget to hit the like button. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can subscribe to my Pharmacology Further e-newsletter. You can follow me on Insta, Twitter, that is X, and LinkedIn. And don't forget to subscribe to this particular podcast on whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.